Many people are concerned about the steroids that they have received during the treatment of COVID pandemic. Even those who have been treated in the home or those who were admitted. Since little knowledge is a dangerous thing, they are a bit concerned what damage this would have caused to their blood supply of the bones. I'm here to clarify certain facts that are associated with the short-term use of steroids which people have received during this pandemic. So what is the effect of the steroids, short-term steroids on the bone? We know that steroids when given in long term have got various side effects, but I am here only to clarify what happens when we take the steroids. When steroids are given, they mobilize the fat, the subcutaneous fat, the fat under the skin and in the body. So what is this? This is in a layman's term, cholesterol and its byproducts. When these increase, they cause small fat emboli, small fat molecules which can get clogged, which can block the blood vessels which supply the end of the bones. And when the blood vessels get blocked, the blood does not reach the end of the bone and hence may result in avascular necrosis. Having said that, this is when long-term steroid is given. Short-term corticosteroids is defined as short-term use of prednisolone 40 to 60 milligrams or its equivalent in a dose in which we decrease it over a period of few days to 3 weeks to a maximum of 400 to 600 milligrams. We still do not have the precise knowledge about how much dose of steroid, how much duration of steroid, which route it was administered, oral, intramuscular or intravenous, which people are going to be affected more than the others with the steroid use. There are evidence in the literature. Previously, it was said a cumulative dose of 2000 milligrams can be damaging. But now there is an evidence that a cumulative dose of 1000 milligrams of prednisolone or equivalent has potential to cause damage to the blood supply of the hips. The interval between the damage of a steroid intake, long term, and damage to the blood supply of the bones varies. It can be 6 months to 1 year. In some cases, it can be earlier than 6 months, and in certain cases, it can be more than 3 years. And also, the progression is very variable. In some people, it is fast, and in some people, it is very gradual and very slow. Most of the people who have problem, they come with the pain in the groin. The pain increases with activity and decreases with rest and painkillers. Yes, when we do exercise, many a times we have aches and pain. But if the pain is persistent and affects your quality of life and your activities of daily living, yes, you must seek an advice of an orthopedic surgeon. So the general advice to the patients who have been on steroid therapy, long-term or short-term steroid therapy, is that they must, if possible, maintain a record of how much dose was given to them and how many days it was given and which route this was taken, oral or intravenous. They must inform their general practitioners, their physicians who are treating them, that they have received a short-term course of steroid so that in future, if it is required, your doctor knows how much has already been given. You must avoid excessive alcohol intake because it further has damaging effect along with the use of steroids in damaging the blood supply. Try to maintain the levels of lipid under control. It can be done simply by a fasting lipid profile, and consult your doctor if the level is high. He may wish to consider medication. Drink lot of water and do regular exercises once you have recovered from COVID, so that your cholesterol levels are anyway good and they do not add to the harmful effects. Thank you.